NCLEX National Council Licensure Examination, NCLEX RN, NCLEX RN free exam questions. Question 1. The physician of an alcoholic client places him on a low-protein, high-carbohydrate diet. When choosing his menu, the client's best choice from the items below would be: Option A, cheese omelette with ham and mushrooms, milk. Option B, liver and onions, macaroni and cheese, tea with sugar. Option C, baked chicken, baked potato with bacon bits, milk. Option D, waffles with butter and honey, orange juice. The correct answer is option D, waffles with butter and honey, orange juice. Question 2. The nurse and prenatal client discuss the effects of cigarette smoking on pregnancy. It would be correct for the nurse to explain that with cigarette smoking there is increased risk that the baby will have: Option A, a low birth weight. Option B, nicotine withdrawal. Option C, a birth defect. Option D, anemia. The correct answer is option A, a low birth weight. Question 3. A psychiatric nurse is providing an orientation to a new staff nurse. She reminds the nurse that psychiatrists often use categories of medications and that it is important that she recall that some categories of medications have synonyms. Another name used to describe minor tranquilizers is which of the following? Option A, anti-anxiety medications. Option B, antipsychotic medications. Option C, antidepressant medications. Option D, anti-mania medication. The correct answer is option A, anti-anxiety medications. Question 4. A depressed client is seen at the mental health center for follow-up after an attempted suicide 1 week ago. She has taken phenylzine sulfate, Nardile, a monoamine oxidase, MAO, inhibitor, for 7 straight days. She states that she is not feeling any better. The nurse explains that the drug must accumulate to an effective level before symptoms are totally relieved. Symptom relief is expected to occur within: Option A, 3 months. Option B, 2 to 4 weeks. Option C, 2 months. Option D, 10 days. The correct answer is option B, 2 to 4 weeks. Question 5. The nurse is assessing and getting a history from a client treated for depression with a monoamine oxidase, MAO, antidepressant. The most serious side effect associated with this antidepressant and the ingestion of tyramine in aged foods may be: Option A, severe diarrhea. Option B, hypertensive crisis. Option C, severe rash. Option D, severe hypotension. The correct answer is option B, hypertensive crisis. Question 6. A 30-year-old client is exhibiting auditory hallucinations. In working with this client, the nurse would be most effective if the nurse: Option A, attempts to direct the client's attention to the here and now. Option B, exhibits sincere interest in the delusional voices. Option C, gives the medication as necessary for the acting out behavior. Option D, encourages the client to discuss the voices. The correct answer is option A, attempts to direct the client's attention to the here and now. Question 7. A client has begun to exhibit signs of alcohol withdrawal. Her blood pressure has risen from 120/60 to 190/100, pulses increased from 88 to 110 bpm, and she is irritable and agitated and has gross motor tremors of the hands. The nurse notifies the doctor. The nurse can anticipate that the doctor will order which of the following? Option A, a phenothiazine such as chlorpromazine, thorazine. Option B, a tricyclic antidepressant such as amitriptyline, Elaval. Option C, a benzodiazepine such as chlordiazepoxide, Librium. Option D, an opiate such as propoxyphene napsylate, Darvocet. The correct answer is option C, a benzodiazepine such as chlordiazepoxide, Librium. Question 8. A 10-year-old boy has been diagnosed with Legg-Calvé-Perthes disease. Which of the client's responses would indicate compliance during initial therapy? Option A, drinking large amounts of milk. Option B, walking short distances 3 times/day. Option C, putting self on weight reduction diet. Option D, not bearing weight on affected extremity. The correct answer is option D, not bearing weight on affected extremity. Question 9. A 33-year-old client is diagnosed with bipolar disorder, acute phase. This is her first psychiatric hospitalization, and she is being evaluated for treatment with lithium. Which of the following diagnostic tests are essential prior to the initiation of lithium therapy with this client? Option A, hematocrit, hemoglobin, and white blood cell, WBC, count. Option B, X-rays, electroencephalogram, and electrocardiogram, ECG. Option C, blood urea nitrogen, electrolytes, and creatinine. Option D, glucose tolerance test, and random blood sugar. The correct answer is option C, blood urea nitrogen, electrolytes, and creatinine. Question 10. In performing the initial nursing assessment on a client at the prenatal clinic, the nurse will know that which of the following alterations is abnormal during pregnancy. Option A, dysuria. Option B, cloasma. Option C, colostrum. Option D, striae gravidarum. The correct answer is option A, dysuria. Question 11. A female client has married recently. A month ago she visited her physician with complaints of burning on urination. She was given a prescription for trimethoprim sulfamethoxazole, Bactrim, DS-Bid for 10 days. She was admitted through the emergency room on Saturday evening complaining of flank pain. Her temperature was 104°F. A preliminary urinalysis revealed 31 bacteria along with red and white blood cells in the urine. A preliminary diagnosis of pyelonephritis was made. During a nursing admission assessment, which statement by the client demonstrates a possible cause for pyelonephritis? Option A, I'm afraid I may have something wrong with my bladder because I have been getting bladder infections frequently since I've been married. Option B, I took the Bactrim for 6 or 7 days. The burning stopped, so I saved the rest of the medication for the next time. Option C, I recently had the flu, which could be settling in my kidneys now. Option D, I have not been drinking 6 to 8 glasses of water each day as the nurse had instructed. The correct answer is option B. I took the Bactrim for 6 or 7 days. The burning stopped, so I saved the rest of the medication for the next time. Question 12. When providing dietary teaching to an individual who has diabetes mellitus, type 2, the nurse discusses the importance of consuming the recommended daily allowance of which of the following electrolytes? Option A, magnesium. Option B, potassium. Option C, HCO3. Option D, sodium. The correct answer is option A, magnesium. Question 13. A 28-year-old multigravida has class 2 heart disease. At her prenatal visit at 34 weeks gestation, all of the following observations are made. Which would require intervention? Option A, blood pressure of 128/78. Option B, ankle edema reported present in late afternoon and evenings. Option C, weight gain of 2 kilograms in 4 weeks. Option D, subjective data, shortness of breath after showering. The correct answer is option D, subjective data, shortness of breath after showering.